Well, this week we're shining a spotlight on a maternal health crisis that's impacting African American women more than anyone else. An African American woman in New Jersey is now 5 times more likely to die of pregnancy complications than her white counterparts.
Yes, so a new program, Nurture NJ, spearheaded by New Jersey's First Lady Tammy Murphy, is really addressing this crisis. And the First Lady joins us this morning to share some of the tips already in place to fight these health disparities. Good morning to you, First Lady Tammy Murphy. We appreciate you being here.
Good morning to both of you, and thank you for inviting me to join, and particularly thank you for spotlighting this. Really important.
It is so very important, and we're going to talk about why. So New Jersey's maternal mortality rates are among the worst in the nation. Where does the Garden State rank right now, and why is it among the worst?
Well, first of all, let me just tell you, the United States as a whole, we are 55th in the world for maternal mortality. So if you think about the amount of wealth and the amount of the quality of our health system, it's ridiculous. New Jersey, unfortunately, is 47th out of 50th. And while that sounds horrible in and of itself, it's even worse because when you dig in, you realize that all women are not treated equally. So if you are a Black woman in the state of New Jersey, you are 7 times more likely than a white woman to die from maternity-related complications. And if you're a Black baby born in the state of New Jersey, you are 3 times more likely than a white baby to die before your first birthday.
Right. So those are frightening numbers.
Frightening, horrible. Yeah.
And obviously, First Lady, your initiative, Nurture NJ, is needed now really more than ever, especially during this pandemic. I remember speaking to you when you had just launched this back in 2019 during the height of the pandemic. I'm wondering, were some of your initiatives halted by this pandemic? Because I knew you already had a tall order and a lot you wanted to achieve with this initiative.
Sure. Well, listen, before the pandemic, we were hosting family festivals and bringing together, state, county, and local resources into communities and providing, then and there resources. And we touched over 5,500 families before the pandemic. Obviously, we had to cancel a lot of those festivals. We couldn't do the in-person meetings, but we've just shifted. We now are doing a lot of things online. We've been hosting an Ask the Professional series. We've done a lot of takeovers of my social media to highlight doulas and other people. So we've been really trying to still communicate with people, and the work has been ongoing. And I'm really thrilled because we actually a couple of months ago unveiled our Nurture NJ strategic plan, which we have been working on and is really groundbreaking. So that's very exciting. We are going to make New Jersey the safest and most equitable place to deliver a baby in our country. So
that is good news, and we want to drill down on that. But as 2 moms here talking to you, a mom as well, I can only speak to my own experience. I had preeclampsia and then placenta accreta, both very difficult situations and could lead to possible death in some instances. I can't even imagine how Black maternal health is dealing with the multi-layered problems. So how do you begin to address this?
Sure. Well, first of all, I'm sorry you had those challenges. I'm obviously glad that you're well.
Thank you.
It is this challenge that we are facing is due to centuries of embedded racism and implicit bias, and it doesn't kind of matter who you are on the spectrum. Serena Williams and Beyonce famously shared their own challenges when they were giving birth, and if they can't raise their own voices and be heard, then it's going to be really impossible for those who don't have as much confidence for the platforms. This week, Black Maternal Health Week, is really about listening and lifting up those voices. And so we are encouraging everyone, look around you, talk to your network, try and hear the stories and share those stories, and raise the moms up, because we've brought together faith leaders, and we've brought together hospital systems, and runs the gamut. Government, everybody is coming together here trying to make sure that we are eliminating this challenge that we have. And I think we actually have over 1,000 stakeholders across the state now who are actively involved with the Nurture NJ program. So we're really moving the needle, but it's going to take everybody together.
Right, and Tammy, like you mentioned, that is really the problem. It's like peeling back the layer, right? This onion. There's so many issues. Trying to get to the crux of it. It really goes deeper, as you alluded to, than just having access to prenatal care. So, how is Nurture NJ going about addressing those underlying issues that are impacting maternal? African-American maternal health? I know initially the goal was to drop that rate by 50%. Where are you now?
So let me just say this. Our goal through the plan is to reduce maternal mortality by 50% over 5 years and to erase the inequities in healthcare. So that's what we're going to do. And how are we going to do that? This takes a transformational coming together for everyone across our state. And I'll give you an example. In my husband's budget plan, the governor's budget plan, he's extending Medicaid coverage 365 days postpartum. And that is a big deal.
Yes.
That's a big deal. So that's like one of the pieces, he's already reimbursing for doula coverage. There's $2 million that's been set aside for housing postpartum for moms who obviously qualify. There are a lot of pieces to this puzzle, and there's a lot of partnership that's going on. At the end of the day, another really exciting piece of this strategic plan. I should have said the strategic plan has 70 explicit action steps for year one alone, 250 over time. I mean, I'm just skimming the surface here, but one really kind of shiny piece at the end of this is we are going to create an innovative maternal health center. And that is where everything will go, and that's our goal at the end of the day once we get underway.
Yeah, centralized place for that. That's fantastic, and I love the fact that you're doing this simply because as moms we see the disparities, we see the problems in the system while you're going through it, trying to have your baby, and after you have a child, a lot of us we get busy with becoming that parent, and you forget there are others that have to follow behind you and are facing those same challenges. So thank you. We applaud you for what you're doing.
Thank you. Please send everyone to nurturenj.nj.gov to try and read the plan and to see how you can get involved in your own community and help elevate those voices this week in particular as we really try and get the word out that this really has been a challenge, and COVID has obviously it's exacerbated it. So thank you.
Absolutely. First Lady Tammy Murphy, thanks so much for all that you're doing. We appreciate you coming on the show today.
Thanks for having me.